from Texas Reserves, the gentlelady from New York is recognized.
Thank you, Mr. Speaker. Good afternoon. I thank the gentleman for yielding me the customary 30 minutes and yield myself such time as I may consume.
Gentlelady is recognized.
Thank you. Mr. Speaker, before I discuss the value of the Affordable Health Care Act, commonly referred to as Obamacare, I must acknowledge the sad fact that this will be the 37th time in 41 months, almost once a month, that the majority has voted to repeal or defund the law, and they know that will not happen. Recent estimates are that each vote to repeal or to defund the Affordable Care Act has cost $1.45 million in taxpayer money. So today's debate will bring the total cost of repeal votes to, wake up there, $53 million and counting. Now, while the majority wastes our tax dollars, think what we could do with $53 million. You know, the agricultural bill we were all talking about this morning is just ready to take $20 billion out of food stamps for feeding poor people. While we waste that kind of money here, doing a bill month after month after month that we know is not going anywhere. But we don't have any positive agenda to put forward here. For the last 2 or 3 months, all we've done are one-house bills. Everybody knows they're not going to get passed, and it really is a tragedy because a CBS study said it cost $25 million a week just to run the Congress, and how deplorable that kind of waste is with all the problems we have in the country. We're told that the freshman Republicans would like once again to have an opportunity to vote to kill health care. I wonder if the freshman Republicans, as I know the freshman Democrats do, wouldn't like to vote to lift the sequester, or maybe do a jobs bill, which we haven't had in 2.5 years. But we are not going to do anything either about the budget, which we heard all the time. Why doesn't the Senate do a budget? The Senate has done a budget. The Senate has asked over and over again for the House to appoint conferees so that we can get the budget put together and pass it into law. No action there either. But because of the sequester cuts, at least 70,000 children have been denied access to early education. Thousands of cancer patients have been denied their regular cancer treatments. The majority say they're holding today's vote, as I said, so the freshmen can repeal the Affordable Care Act. I wish to goodness that they would give them something that will really pass and something good to vote on. Instead of voting to repeal the sequester, the majority is voting for the 37th time to repeal a law that, and this is very important, what this law has done already, it has given 100 million Americans access to free preventive health care and measures such as mammograms and colonoscopies. That's 100 million already. They are voting for the 37th time to repeal a law that saves seniors $6.1 billion in prescription drug costs already. They are voting for the 37th time to repeal a law that has provided 3.1 million young adults with health insurance that they otherwise could not afford already. The Affordable Health Care has been particularly beneficial for America's women. Did you know that passage of this law in 8 states and the District of Columbia, domestic violence was classified as a pre-existing condition and you could be denied insurance? They were denied that because they had been abused and perhaps they would be again. Did you know that thanks to a practice called gender rating, women were charged as much as 46% more in premiums for the same level of insurance as a man? Maybe not. Maybe you didn't know that, but lots of women in the country are getting rebates for that very reason. Because of the Affordable Care Act, both of these discriminatory practices have been outlawed. In addition, the Affordable Care Act has already returned money to the pockets of millions of women thanks to the rebates required by insurance companies under the health care law. And finally, the Affordable Health Care outlawed lifetime and yearly limits, insidious insurance practices that cap the amount of health care and insurance a company would provide. But because of health care reform, Americans no longer have to worry that they will be denied health care that they need simply because insurance companies refuse to pay for their continued care. And did you know that 85% of your premium dollar will go to health care, not to other things that the insurance company wants to spend it on? Now, the majority has claimed that the Affordable Care Act is bad for America's small businesses. The truth is that any small business that has less than 50 employees requires them to do nothing different, nothing at all, than what they're doing today. But a small business with less than 25 employees are eligible for a tax credit of 35% right now. And on January 1st, that tax credit will increase to 50%. You will get a tax credit on half of the health insurance you pay to your under 25% employees. 25 employees, excuse me. Now, the majority has also claimed and will continue to claim that the Affordable Health Care was passed in the dark of night through closed-door processes that denied their side of the aisle the opportunity to participate in the legislative process. This charge is categorically untrue. The Affordable Health Care Act was the product of nearly 100 hearings, 83 hours of committee markups, including both Republicans and Democrats making amendments. The House heard from 181 witnesses, both Democrat and Republican. 239 amendments were considered in House committees, and 121 were adopted. And while some on the other side of the aisle have charged that the final version of the law was rushed through the House, the final bill was available for 72 hours before any members were asked to vote on it. In contrast, the Patients' Rights to Repeal Act, which we are doing again today, I said for the 37th time, is being considered after no committee hearings, no committee markups, and under a closed rule. That means there will be no amendments on this bill. Even if one was sympathetic toward the majority's goal, the complete abuse of the legislative process should give every member of this chamber pause. Mr. Speaker, today's vote is just the latest in the majority's all-out effort to undermine the process of implementing the health law. Their efforts have taken many forms, but central to it all is their refusal to provide the necessary funding to fully implement the law, and a gleeful willingness to criticize an implementation process that is underfunded and undermined at every single turn. But despite their best efforts, I believe that in years to come, the majority will find they stood on the wrong side of history, just as they stood on the wrong side of history when Social Security was and when Medicare came into being. Indeed, the opponents of the Affordable Care Act have already had their day in court. Last summer, the Supreme Court affirmed the constitutionality of the Affordable Care Act, putting to rest any false legal concerns that opponents had. And while the constitutionality of the law is no longer a question, one might expect opponents to criticize the law's impact on our nation's finances. But here again, the facts will stand in the way. Over the last 3 years, U.S. healthcare spending grew at 3.9%. That, Mr. Speaker, 3.9% is the lowest growth rate in 50 years. And according to the Nonpartisan Congressional Budget Office, repealing the Affordable Care Act would actually increase our nation's deficit by more than $100 billion over the next 10 years. Please think of that and understand what they are trying to do away with today, the things that help you. Mr. Speaker, providing safe, secure, and affordable health care for our citizens has been the goal of both Republican and Democrat lawmakers for generations. As far back as Theodore Roosevelt, we acknowledge the need to provide our citizens with a health care system that puts their health before industry profits, that has good outcome as other parts of the world provide for their citizens. And we need to treat health care as a right, not a privilege, for the lucky few. Now, under the leadership of a Democrat Congress, we managed to realize, at long last, this long-awaited goal by passing the Affordable Care Act through an open, deliberative, thorough legislative process. And from reducing our nation's health care spending to expanding the health care to millions of Americans who could not afford it, the affordable health care is succeeding. It is in light that the majority's 37th vote in 41 months to repeal health care should be judged. And it's hard to judge their politically driven vote as anything other than a disservice to the American people, a waste of taxpayer money, and a way to spread misinformation. I urge my colleagues to reject today's rule and the underlying legislation. And I reaffirm my pride in supporting a law that is already helping to save lives and already providing American people